My name is Anne Kemp and I'm a nurse immunisation expert. There are two main messages that I'd like to give you today about giving multiple injections on the same day. One is that we must give our injections with excellent technique to reduce the amount of pain. And second, we as doctors and nurses need to ensure we are confident when we are dealing with parents giving multiple injections so they too will be comfortable.
The right technique can make a big difference in reducing injection pain. If administered correctly, many children will not cry when vaccinated. Although it is important that the baby doesn't move during the injection, be careful that it is not held too tightly, as this may increase fear and therefore pain. There is a choice of two positions, depending on the age of the child and the wishes of the carer. Some carers prefer to hold the baby. Children under 12 months can be held in this semi-recumbent position on the lap of the carer. You may have to undo the baby's nappy so you can see all of the anatomical landmarks. Otherwise, the vaccine may be given too low in the thigh. The anterolateral thigh is the recommended site for giving intramuscular injection to children under 12 months. This is the safest site. It avoids the risk of local reactions because of the relatively large size of the vastus lateralis muscle. It avoids the risk of chronic injection site nodules associated with the accidental injection into the neurovascular bundle, which lies in the anteromedial thigh. This site also avoids the thicker layer of subcutaneous fat on the anterior thigh. Injecting into muscle rather than fat decreases pain. The deltoid muscle of the upper arm is the preferred site for children over 12 months. The hug position is preferred. Place the child's arms under the carer's arms and ask them to hug the carer. The standard needle for intramuscular vaccines is 23 gauge and 25 millimeters in length. The use of a needle that is too short will increase pain because it will not penetrate deeply enough into the muscle. To find the preferred site, look for the junction of the upper and middle thirds of the vastus lateralis, which is the bulkiest part of the muscle. The muscle should be bunched up to increase muscle mass.
A quick alcohol wipe does not sterilise the injection site. Unless the skin is visibly dirty, alcohol wipes are unnecessary and can only cause pain and irritation to the needle tract.
The needle should pierce the skin at an angle of 90 degrees to the skin and can be safely inserted to the hub. The correct site for intramuscular immunisation is lateral to the midpoint of an imaginary line between the upper and lower anatomical markers of the thigh. Never give injections in the buttocks.
The angle of the needle is important in reducing pain. It results in less tissue resistance when the needle penetrates the muscle. Injecting slowly also reduces pain.
When 3 vaccines are given at the same time, 2 injections can be administered in the same anterolateral thigh, but the injection sites should be separated by at least 25 millimeters, so the local reactions will not overlap.
3 injections at once need not be traumatic for the baby. It is possible to put the child at risk from vaccine-preventable diseases because of delayed immunisation. Deferring of vaccines increases the child's risk from a specific disease.